Are you looking for a good cancer treatment for your friend? Here I will help you in this video how to go about. So the frame of reference that we are going to use for this video is COT, Breakthrough and Session. The reference movie which I will use to explain is Bhul Bhulaiya. If you have seen the movie, you will be able to correlate what I'm trying to explain. So this is a scene, caught scene from the Bhul Bhulaiya movie, where the modified version of Avni is getting angry and expressing her anger by lifting the cot. And the original version of Avni is realizing that something is wrong with her. Now that Avni is able to take up this information, process this information, he is made to go through a more intense session so that the modified version leaves her forever. So, in this particular scene, the breakthrough scene, what is she doing? The modified version is expressing her highest anger against the king. And after the anger is being expressed, she gives a sigh of relief and she feels a bit of comfort because the anger has been expressed. And now she moves up to the next thing, that is, this was a controlled environment. Please make a note of this. This could have been gone wrong. There are risks available, risks in this uh, area, but they have to be executed in a controlled environment. And then, after the patient has accepted the changes, the patient is furthermore given support to recover uh, gradually to the original state. So here Akshay Kumar is giving her, Avni, the session so that the modified version never comes back to her and she is able to live her original sense with a new purpose and function. So, the correlation in a cancer patient that will explain you this concept is that a cancer patient's treatment basically goes through three things: perpetual preservation, prevention of recurrence, and re-expression of transformation. In the perpetual preservation section, it's like maintaining the integrity of the individual. So, whatever important structures are there around the tumor need to be protected, and whatever genuine feelings that the person has, they have to be preserved. In the prevention of recurrence, it's like defining the margin of the tumor and eradicating it such that no tumor residue is left behind, so that the second version of the diseased version doesn't come back again. And then you go for the re-expression for transformation so that it is completely eradicated and no emotional residue is left behind in the patient's mind. That is just a help for the patient to recover out of the intense scene, which of course needs the cooperation of both the doctor and the patient. So this picture will help you correlate that where is the lesion, where is the tumor, which is the non-lesional area where the tumor is not there, but that needs to be kept intact for a normal function of other organs in the body which are not affected. But when you take a margin, negative margin is what is required, because if there is a positive margin, the second version, diseased version, can come back. So, to avoid that, some part of the healthy tissue around the tumor also needs to be removed. Now, this also needs to be carried out into a controlled environment. There are risks in this as well. Finally comes the re-expression for transformation. Now, once the surgery has been done, there is a hollow area where the tumor was removed. Now, this hollow area is being filled up with a compatible patient tissue compatible uh, material so that the patient can function normally, similar to before, not completely same as before, similar to before, so that the patient can feel much better than what he was feeling before the surgery or the treatment for that matter. So please let me know in the comments box whether you could correlate the example given in this video and whether the information given in this video was helpful at least to certain degrees to face the fear of cancer. Now, see, uh, what pain is there has to be faced definitely by the patient. That cannot be replaced by us. But this can at least give some 5%, 1% help to cope up and inspire cooperation from the patient for the success of the treatment. You could see in the breakthrough session that Avni has given a sigh of relief and she is approving the session being conducted on her. Her body is approving that, oh, I feel relieved after this process. So that kind of cooperation can be inspired from the patient. And please let me know whether this video had even a spark of it for cooperating. Thank you so much.